Hello, magandang araw po and welcome to MyDentistSays. Ito po ulit si Dr. Arnel Makay. This past few weeks, I became so busy because nag-open na po ang clinic practice ko and we did some changes in our clinic because we followed the interim guidelines proposed by our mother organization, the Philippine Dental Association, to make our dental practice safer to our patients, to me, and to my staff. So, pagpasok niyo po ng clinic, there will be a little bit changes sa clinic, ang isolation room namin. We bought some equipments like the aerosol vacuum, the UVC light, and we have also isolation gowns, all those stuff. Just to make our practice safer. Because alam niyo naman, meron tayong pandemic, COVID-19. Okay, now my topic for today is not something new. It's something that our patient has to do every day on a regular basis. Okay, this is my topic for today is about oral hygiene, and see for yourself if you can benefit more on this so-called modified oral hygiene. Okay. Okay, the first step on our modified oral hygiene routine is rinse water. For example, kakakain mo lang po ng dinner, lunch, o breakfast. You have to rinse water. Why? One, natatanggal po yung mga food debris or yung tinga. Second, nababawasan po yung acidity ng bibig mo. Kunyari, may makinain ka ng mga spicy food, no? Napapawasan yung acidity. Third, nababawasan yung pag-stain sa ngipin mo. If you ate something colored food, nababawasan yung pagka-sticky sa ngipin mo. So, nalilesen ng stain. And fourth, nababawasan yung smell nung kinain mo. So those are the reasons why you would like to rinse water first. Okay? Now, number 2, brush your teeth with a soft bristle or medium soft bristle toothbrush. Wag po yung hard bristle kasi yung hard bristle, I think, pang denture na yan or pang postizo. At kung hindi ka maingat using a hard bristle, nakakasugat ng gilagid or gums mo. So stick with the soft bristle or medium soft. When you buy it in the market, tingnan mo lang sa package niya kung nakalagay soft or medium soft and you'll be fine. Okay, so why brushing and so using your toothbrush, wala mo ng toothpaste. Okay, no toothpaste. Why? Kasi nababrush mo yung ngipin mo at kung may face mirror ka, nakikita mo kung may mga food debris, may mga tinga or na mga kinain mo na pwede mo siyang masungkit. Okay, so yun ang reason behind doon. Kasi pag nilagyan mo na ng toothpaste, nakikita mo white na lahat So you thought na malinis na yung ngipin mo after brushing. And then you rinse it 3 times. Gargle or rinse thoroughly 3 times. Okay? Okay, number 3 is brushing now with toothpaste. Okay? Sa toothpaste, you can use any brand of toothpaste na ginagamit mo na or ni-recommend ng dentista mo. Okay, may mga medicated toothpaste kasi na for special cases, no? Meron din yung mga regular toothpaste. Okay? So what matters most is the fluoride concentration doon sa mga toothpaste na binili mo. You can look on the package and see yung 1,500 ppm. 1,500 ppm. That's the concentration of fluoride that you can use sa ating mga adult. And also sa mga 7 years old na bata pataas, that's already enough concentration for them. The size of the toothpaste is only a pea size or size ng butil ng mais, and that's already enough for everyday brushing. Sa mga ages from 7 years old up to adult, yung pea size is or size ng butil ng mais is already enough. Now, pagdating naman sa mga 6 years old below, half of the butil ng mais is already enough para po the everyday brushing ng mga anak natin. Okay? So that's it, no? And also, when you brush your teeth, follow the proper way of brushing, yung 45-degree angle, then brushing in a one stroke. Ako, what I find it effective for me, and I share with my patient, is I brush it in one stroke, going down, no? Pag mula from sa gilagid, no? You press the brush a little bit, and then you brush it one stroke, going down. Okay, ito yung mga ngipin sa taas, harap, going down. Okay, para lang tayo, diba? Para tayo nagwawalis. One stroke lang, one stroke, pababa, okay? From the gum tissue, pababa. From the gum tissue, pababa. Ako, mas na ano ka doon, effective, okay? And then, pag nandito naman sa babang ngipin, pataas, okay? Pataas. One stroke din, pataas, okay? Take time when you brush your teeth. Don't be in a hurry. Sabi nga nila, para ka lang, you have to sing a song in your mind, no? Mga 2.5 to 3 minutes of parang ang length of brushing. Okay? And then, where do you scrub? You scrub your teeth dun sa ibabaw. O, yung mga molars, o tinatawag nating bagang, yan ang ini-scrub talaga. Para matanggal mo yung mga food debris na nakastuck o nakastuck dun sa pits. We call it pits. Kasi yung mga bagang or molars, may natural pits yan eh. So, doon, nag-stuck yung mga sticky food mo, then that's the area you really have to brush. Okay? Pero yung mga ngipin natin dito sa harapan, okay, then you have to do a one stroke, downward motion, pag mula sa taas, pababa. Pag dito naman sa baba, mula baba, pataas, okay? One stroke motion lang. Okay? So that's the way you would like to brush your teeth. Okay? May mga patient ako they're asking me, Doc, how many times ka bang dapat mag-brush ng ngipin mo? We recommend twice or thrice. Pero never once. It's always twice or thrice in a day you brush your teeth. Okay? Para talagang you maintain the cleanliness of your teeth. Next is number 4, brushing and scraping your tongue. Kayo ba nagbabrush and scrape ng inyong dila? That's very important. Okay, doon muna tayo sa brushing. When you brush your tongue, yung iba po kasi daw naduduwal o nasusuka, kaya hindi sila makapag-brush ng kanilang tongue. Okay, this is how I do it. I take a tissue paper and I literally hold my tongue. Okay, hinihata ko pa ng konti yung aking dila. And then my toothbrush, as far as I can, I brush it once, one stroke going up. Okay? One stroke going up. Okay? So I brush it in one direction pala. Okay? So I brush my tongue. And then para hindi ako masuka, sinasabayan ko ng word na ha. Ha, no? Para sa ganun, di lang ako masuka, dinidistract ko yung sarili ko. Okay? So after that naman, we go scraping. Yes, when I do tongue scraping, I use a tongue scraper. Okay? May mga tongue scraper po kung nakikita na walang ngipin, no? Yung katulad pang ito, baka may nakikita kayong ganito na tongue scraper. Pag nakita mo siya, pag kinawakan mo, wala siyang masyadong ngipin o wala siyang ngipin, smooth lang siya. Okay? What I like is this one, no? This tongue scraper naman, bale, meron siyang maliliit na ngipin. Okay? Double-sided siya, top and bottom, may mga maliliit siyang ngipin. Okay? So, what I do, I fold it like this. O kaya naman, kung may makita kayong ganito, wala pa kasi ako nakitang tongue scraper na may ngipin na ganitong design. Okay? Yung ganito, bale, I'm sure mga dentist nyo, meron silang mga ganitong tongue scrape. Okay? Ulitin ko, double-sided siya, may parang ngipin. So, I fold this, same way. I hold my tongue with a tissue, and as far as I can, no? Hanggang sa likod ng dila ko, bale, I scrape it outside. Sinasabayan ko rin po ng ha. Okay? Para ma-distract lang ako. So, I scrape my tongue. So, why do you do this? Because scraping the tongue, ang dila po natin para siyang rug. Para siyang carpet. No? Nanunuot sa dila natin yung mga kinain mo, yung mga some food debris nandyan, o kaya yung mga sauce na mga kinain mo nandyan. And dahil nasa dulo sa ng dila, doon sila nag-stack up. So kahit anong brush mo, napansin mo, bakit may amoy pa rin? It's because that part na hard to reach at hindi na scrape. Okay? So minsan naman, pag ikaw sinisipon, tumutulo doon sa likod. Yung ilong o yung passage ng ilong, yung nasal mo, pati doon sa throat, tumutulo doon. So kung hindi mo siya ni-scrape, andun siya. So yun na minsan na nagkakos din ng bad breath. Okay? So that's the reason why I recommend tongue scraping. Gaano kadalas? Siguro once or twice a day. Especially pag may kinain kang flavorful o may kinain kang masyadong maamoy na pagkain, you do the tongue scraping. Now, pagdating naman sa mga anak natin, mga toddlers, no? Mga below 6 siguro, below 5, let's not pressure them na doing the tongue scraping kasi baka mamaya masugatan yung dila nila kasi hindi pa nila alam paano gawin. You really need to supervise them on doing the tongue scraping. Okay? And then siguro unti-unti matututunan din nila. So it needs supervision when you do tongue scraping sa mga anak natin below 5, I guess. But yung mga nakakaintindi ng anak natin, mga 7, 8 onwards, then I guess you can teach them or sabayan nyo sila when they do the tongue scraping. Okay, that's the reason why I recommend tongue scraping. Next, number 5 is flossing. There are two types, wax or unwaxed dental floss. kung yung mga ngipin mo masyadong tight contact, no, ang hirap ipasok ang floss, yung wax dental floss, mas makakapasok siya kasi nga madulas siya. Pero you also be very careful kasi minsan pag nanggigigil ka na ipasok yung dental floss, biglang papasok bigla. Pag hindi mo na control, tumatama dun sa gilagid mo at nakakasugat. So yun ang problem sa wax dental floss. And also, pag meron super fine debris na nakakapit sa ngipin mo, I feel na yung wax dental floss hindi masyadong kumakapit yung debris of food, no, yung mga pero yung mga normal debris of food naman, yung may mga konting kalakihan, it does the work, natatanggal niya naman po yung debris of food. Doon naman sa unwax, kung ang ngipin mo naman meron naman siyang konting spaces or hindi mahirap ipasok ang wax, yun po, yung unwax floss will do the work, no? Then may pagka-rough din siya ng konti, hindi ganito na may pagka waxy. So, yung pong okay po yun. Kasi yung mga super fine food debris, I feel dumidikit naman siya. Okay, when you do the flossing, just follow yung, di ba, may gum tissue ka na triangle siyang gano'n, di ba? You just follow yung shape ng gilagid mo. Okay? So yun lang, dahan-dahan, okay? Hindi mo kinakailangan paduguin yung gilagid mo. So dahan-dahan lang ang flossing, okay? Kasi ang target mo lang is yung mga hindi nakuha ng brushing mo, sa brushing mo, the floss will help you to remove those very fine debris of food, okay? And also, it doesn't matter if you take, 18 inches floss, no? Kasi dapat something that you can really hold on to it when you do the flossing. Okay? So that's the use of the dental floss. Now, pagdating po pala sa mga bata, no? I would advise na you guide them when you do the flossing. Okay? Or whenever they visit their dentist, ask your dentist, can you please show my son or my daughter how to do the proper flossing? Okay? Para sa ganun, they'll be guided the right manner of flossing kasi mga bata pa sila. Tapos sa mga patient naman na naka-crowns or naka-bridge, naka-porcelain bridge, okay, naka-metal bridge, I would advise na you buy a floss threader. Most of the dental office has a floss threader. Yung floss threader po, para siyang will help the thread na maipasok mo siya doon. No? Your dentist has it. Let them demonstrate it to you, lalo na kayong mga naka-bridge or mga naka-braces, no? You can use the floss threader para matulungan sa paggamit ng inyong floss. Mga questions po na how many times I do the flossing? Twice a day is already enough, especially at night, kasi imagine matutulog ka 8 hours the whole night, na kung meron natirang tinga doon, natirang food debris doon, then sometimes it irritates the gums, and that's the reason why na lalo na pag matutulog ka sa gabi, you do the flossing. Okay? Okay, number 6 is mouthwashes. Mouthwashes, whatever mouthwashes that you have been using, recommended by your dentist, then you can use that. Just follow how your dentist told you to do your mouthwashes, and also what's instructed on the label of the mouthwash you bought. Ngayon, then meron tayong COVID-19 pandemic. Based on the interim guidelines from the PDA, there are 3 mouthwashes that they recommend to reduce the viral load sa ating bibig. So what are they? Number 1, we have 1% hydrogen peroxide. Number 2, you have 0.2% povidone iodine. And number 3, you have chlorhexidine. Okay? So I think that's about it. I hope you find the information given today very helpful, and I hope you would try it. And you can give me some comments, find them effective, give me some comments. If you don't find them effective, then give me some comments as well. Maybe I can still find other ways na meron pa tayong other informations to make our oral hygiene routine better. Okay, thank you. Oh, by the way, I'm planning to do a Q&A video soon, so check out my Instagram about that. Or you can also comment down below your questions about dentistry or anything about your dental health, and I'm going to answer on my next video. Okay, thank you so much, and be safe everybody. Bye.